Welcome to our discussion on solving hematology diagnostic challenges, real-life case studies. Hematology, the study of blood, blood-forming organs, and blood diseases, is a complex field where accurate diagnosis is vital. It's like being a detective, where every detail can be a clue to solving the puzzle. Today we will explore a series of real-life case studies that highlight the importance of thorough investigation and precise diagnosis in hematology. From anemia, due to vitamin B12 deficiency, to high white blood cell count caused by bacterial infections, these cases will illustrate the diverse challenges faced in this field. They will also demonstrate how targeted and effective treatments can significantly improve patient outcomes. So, buckle up for an insightful journey into the world of hematology, where every cell has a story to tell. Join us as we delve into the first of our real-life case studies. Our first case revolves around a patient presenting with anemia and fatigue. This individual, just like any other, was leading a normal life until these symptoms started to interfere. Anemia is a condition characterized by a decrease in the total amount of red blood cells or hemoglobin in the blood, leading to less oxygen reaching the tissues. Fatigue, on the other hand, is a feeling of constant tiredness or weakness, which can be physical, mental, or a combination of both. In the medical world, these symptoms can be a sign of numerous conditions, and it's critical to carry out comprehensive testing to pinpoint the cause. In this case, the patient underwent a series of tests, including a complete blood count, blood smear, and vitamin level tests. The diagnosis? Vitamin B12 deficiency. Vitamin B12 plays a crucial role in the production of red blood cells. When there's a shortage, the body struggles to produce enough, leading to anemia. But how does one end up deficient in this essential vitamin? There are several reasons. It can be due to a diet lacking in B12-rich foods like meat and dairy, a condition affecting absorption in the stomach such as pernicious anemia, or even certain medications. Once diagnosed, the focus shifted to treatment. The patient was prescribed vitamin B12 supplements designed to boost their levels. And here's the thing about vitamin B12 deficiency. It's treatable, and most people can make a full recovery, especially when detected early. Our patient was no exception. Over time, with regular supplementation, the patient's hemoglobin levels improved, and the fatigue lessened. This case highlights the importance of comprehensive testing in diagnosing hematological conditions. Anemia and fatigue could have pointed to an array of issues, but thorough testing led to the identification of vitamin B12 deficiency. This allowed for a targeted treatment approach, which ultimately led to improved health for the patient. Remember, early detection is key to effective treatment. So listen to your body, understand the signals it sends, and never hesitate to seek medical help when needed. The next case involves a patient with an unusually high white blood cell count. This is a common symptom that can be associated with a variety of conditions, but in this particular case, it was a signal of a bacterial infection. The patient was feeling generally unwell and had a fever, coupled with a high white blood cell count. These symptoms are often the body's way of indicating that it's fighting off an infection. However, the specific cause of the infection still needed to be determined. To pinpoint the source, doctors conducted a series of tests, including blood cultures, a complete blood count, and a physical examination. The blood cultures helped identify the specific bacteria causing the infection, while the complete blood count provided a detailed look at the different types of cells in the patient's blood. The physical examination, on the other hand, helped doctors understand the patient's symptoms better and check for any abnormalities. The test revealed a bacterial infection, and the doctors set to work determining the most effective treatment plan. In this case, the patient was prescribed antibiotics, a common treatment for bacterial infections. Antibiotics work by either killing the bacteria or preventing them from multiplying, helping the body's immune system to overcome the infection. This patient's response to the antibiotics was positive. Over a period of a few weeks, their white blood cell count gradually returned to normal levels, and their symptoms subsided. This successful outcome underscores the importance of accurate diagnosis and targeted treatment. However, not all high white blood cell counts are due to bacterial infections. They can be caused by a variety of other conditions, including stress, inflammation, or even certain types of cancer. This is why it's so crucial for doctors to conduct thorough investigations and not jump to conclusions based on a single symptom. As we see, a high white blood cell count can indicate different conditions, underlining the importance of in-depth analysis. It's always important to remember that each patient is unique, and a symptom that indicates one condition in one patient might signal something entirely different in another. Our third case study concerns a patient with a low platelet count. Let's delve into this intriguing case. A middle-aged individual came to their doctor, complaining of unusual bruising and prolonged bleeding from minor cuts. After a routine blood test, it was found that the patient had a significantly low platelet count, a condition known as thrombocytopenia. The medical team didn't stop there, knowing that low platelet count is usually a symptom, not a disease in itself. It's like a clue, hinting at some underlying condition. To find out what was causing the low platelet count, they carried out a series of tests. They checked for common culprits like anemia, liver diseases, and even certain types of cancer. But all these tests came back negative. Now here's where things get interesting. They decided to test for viral infections, and bingo, the results came back positive for a common viral condition. It was a bit of a surprise, as viral infections are not always the first thing that comes to mind when you see a low platelet count. But in this case, it was the hidden cause. So, what happened next? The doctors prescribed antiviral medications to combat the virus causing the havoc. And here's the good news. As the patient started taking the antiviral medications, the viral load decreased, and their platelet count began to rise. Over time, the bruising and bleeding issues resolved, and the patient returned to their normal life. This case study is a testament to the medical detective work that goes into diagnosing conditions based on blood test results. It highlights the importance of considering all possibilities, including those that may not seem obvious at first glance. It shows that in medicine, as in life, things are not always what they seem. And above all, it underscores the crucial role that platelets play in our body. These tiny blood cells might be small, but they are mighty, and even slight changes in their number can have significant impacts on our health. This case serves as a reminder that even subtle changes in blood components can signify serious conditions. The fourth case study introduces a patient with a high red blood cell count. This patient came to the doctor's office, puzzled by the results of their recent blood test. The high red blood cell count was a mystery, as they felt relatively healthy, with only minor complaints of fatigue and occasional headaches. The healthcare professionals began a meticulous process of deduction. They performed a series of tests, digging deeper into the patient's medical history and lifestyle habits. They assessed the patient's diet, hydration, and even altitude exposure, all of which could potentially elevate red blood cell count. But everything seemed normal. Then, they turned to the patient's sleep habits. The patient admitted to snoring loudly and waking up feeling tired, despite getting what they thought was a full night's sleep. This clue led the healthcare professionals to suspect sleep apnea, a sleep disorder where breathing repeatedly stops and starts during sleep. To confirm this, they conducted a sleep study. The results were striking. The patient's breathing was indeed stopping and starting throughout the night, causing a decrease in oxygen levels in the blood. This decrease triggered their body to produce more red blood cells, leading to the high count observed in the blood test. The puzzle was finally solved. The patient had sleep apnea. The solution to this problem was a device called a continuous positive airway pressure, or CPAP machine. This device provides a steady stream of air to keep the patient's airways open during sleep, ensuring a constant supply of oxygen. The patient started using the CPAP machine, and over time their red blood cell count returned to normal, and their symptoms of fatigue and headaches diminished. This case study illustrates that hematological presentations can sometimes be symptoms of non-hematological conditions. It serves as a reminder that healthcare professionals must always keep an open mind, viewing patients holistically and considering all potential scenarios in their quest for accurate diagnosis and effective treatment. Our final case study involves a patient with a low white blood cell count. The patient's symptoms included fatigue and frequent infections, leading healthcare professionals to explore the cause. During the diagnostic process, it was discovered that a medication the patient was taking was causing a decrease in white blood cells, a side effect not commonly associated with this particular drug. The solution was to immediately stop the medication and monitor the patient closely, while searching for an alternative treatment. Over time, the patient's white blood cell count improved, and their symptoms subsided. This case emphasizes the need for a thorough patient history and the impact of non-hematological factors on blood counts. We've explored several real-life case studies today, each highlighting different hematology diagnostic challenges. From the case of vitamin B12 deficiency to that of medication side effect, we've seen how a thorough investigation can lead to accurate diagnosis, which in turn opens the door for effective treatment. Each case emphasized the critical role of precise identification of the root cause of symptoms. Through understanding the underlying issue, be it a bacterial infection, a viral infection, sleep apnea, or a vitamin deficiency, healthcare professionals were able to provide targeted treatments that improved the patient's outcomes. These cases underscore the importance of accuracy in hematology diagnosis. It's not just about treating symptoms, but about treating the whole patient, pinpointing the origin of their health issues, and tailoring the treatment accordingly. Remember, accurate diagnosis is key to effective treatment. Thank you for joining us on this journey through hematology diagnostic challenges.